Biostage, regenerations ahead. Worldwide, an estimated 456,000 new cases of esophageal cancer occur each year. In 2015, in the United States, there were roughly 17,000 new cases of esophageal cancer and more than 15,000 deaths from esophageal cancer. Patients with a diseased esophagus caused by conditions including Barrett esophagus or esophageal cancer can be treated with an esophagectomy, a surgical procedure that removes some or most of the esophagus. At the end of the esophagectomy, the esophagus can be reconstructed by either reshaping the stomach and connecting it to the free end of the digestive tract, or by removing a portion of the intestine and relocating it to where the esophagus was removed. The current surgical procedure has a 90-day mortality rate as high as 19%. Life-threatening complications can occur following a standard esophagectomy. Major pulmonary complications can develop in more than 1 out of 3 patients. Leaks occurring at the junction of the reconstructed esophagus arise in up to 30% of the patients and can lead to infection and sepsis. Other complications of esophagectomy can include narrowing of the reconstructed esophagus, gastroesophageal reflux, and dumping syndrome, which can all highly reduce the quality of life that patients experience. Biostage aims to radically change the treatment paradigm after an esophagectomy. With their pioneering Cellframe technology, the patient's native esophagus can be regenerated. 2 weeks before an esophagectomy, stem cells are retrieved from the patient's abdominal adipose tissue. The stem cells are isolated and expanded. Then, inside a bioreactor, a porous cell span implant is incubated with the stem cells. The cells adhere to and interact with the implant. At the end of the esophagectomy, the cell span implant, seeded with stem cells, is then implanted to reconstruct the patient's own esophagus. Preclinical studies showed that the stem cell-seeded cell span implant possesses all of the necessary cues to start and guide the regeneration of a layered biological structure. This includes all the specialized cell types of the native esophagus with significant regeneration of the muscle components. Biostage is also investigating their Cellframe technology to replace diseased sections of the trachea or bronchus, possibly life-threatening conditions that are underserved by current therapies.